Hello, hello, hello. Today is day 9 of my stay here in New York. I am off today. Initially, when I signed on to come, there was not going to be any day off, but the hospital didn't feel that it was safe for us to work so many days in a row, so they are giving us days off. Um, so it just depends on which hospital you are assigned to. The but unfortunately they've switched me to night shift for the next 4 days. Well, maybe it's just a blessing in disguise, I don't know, but I've been switched to nights for the next 4 days. I haven't done nights in a long time, so I don't know how that's gonna go. I remember working nights is not for everyone. I remember doing nights and having migraines. That's one of the reasons why I had to stop doing that. I had migraines and I couldn't sleep during the day. Yeah, and too much noise. Like you can hear, they are doing a lot of work downstairs here, and I have to take a nap before I go back to work. And yes, it's noisy. But anyways, so my typical day, since I've been here, we are pretty much, when we are here in the hotel, we are advised to stay in our rooms and avoid, gathering, to minimize, to keep the distancing we are supposed to. But anyway, stay in your room as much as possible. We can still go out, but we have to sign out when we go out. But in the room, typically, when I wake up, what time? Probably 5 o'clock or so. No, actually 4 o'clock when I have to work during the day. Wake up at 4 o'clock. I used to wash my own scrubs, but it's time consuming if you want to wash them right. And so I just started taking them to the laundry room to get more sleep, because I was sleeping initially just 4 hours at night, waking up, and the sleep wasn't really good. Which yesterday, thank God, I was able to get 7 hours of sleep uninterrupted, which was pretty nice. So now I have to adjust again, go into night shift. That's going to be a little bit hard for me to do. But typically, when we go to the hospital, we have our scrubs. We're on the bus. We get over there. We go get our N95 mask. We also get a regular mask, and we also get a face shield. The face shield also has a mask on it, so I kind of have like 3 protections on. And you get a head cover, hair cover, and then shoe cover also. Then when we go in the room where we are going to work, with the other doctors, PAs, we pretty much clean our work area, like the chairs, the computers, stuff like that. We have to clean all that, make sure it's good and clean for you before you start working there, because you don't know who has been sitting there and what they had. And of course, as we go in the patient's room, we wear our, the gown. We have to gown to go in the patient's room, but also we are told to stay in the rooms as less as possible to minimize exposure. So pretty much it's a question of coming in the room, talking to the patient, seeing, how they're breathing, how is their breathing, are they coughing, are they short of breath, checking their oxygen, is it dropping? Because the goal is, a lot of people are on, pretty much most people are on oxygen or non-rebreather mask. If they have to, the maximum for the non-rebreather mask is 15 to 16 liters. And if with that they are below 90% or deciding, meaning it's dropping, that's not a good sign, and they most likely will have to be intubated at some point. So that's when we just start talking about, what is your wish? Do you want CPR? Do you want to be intubated, and things like that? And also based on the age of the person, that will determine whether, we are, talking about being a DNR, DNI, and what they have going on. But we want to start having that talk, and call the families, let them know what's going on. If it's not improving, kind of keep them informed. I've had to call family members, let them know that the situation is not good and that they should prepare themselves. I've had people ask me, how long is that going to take? I don't know. Only God knows. You know, it can be few hours, it can be few days, it can be, I don't know, God only knows. But based on what we are seeing, you know, we have to call them and let them know whether the situation is not looking good or not. We are not advised to give false hope, but just be point blank with them. So that's kind of hard. I've gone in patients' rooms, and specifically this lady, I went to see, her roommate was my patient, and the lady right next to her wanted me to talk to the person on the phone, and I had to tell her that I couldn't, because you know, you have your gloves on. If you come with your mask, you know, and you come and put that phone to your ear to talk to the person, guess what? You just contaminated yourself. So I cannot do that. And you know, those hospital phones don't have speakers, are not on, there's no speakerphone. So I had to tell her that I couldn't help her, and that's really hard to not be able to help. Like, people say, oh, wait, I'm coming. If they're in the restroom, I can't stay that long and wait for you. I have to get out of there. If I have more questions to ask, I have to pick up the phone and call the room to communicate. If they need a translator, I don't do it inside the room, I do it outside of the room. Use the phone outside, and you know, the translator call them in the rooms, and that's how we have our conversation. The goal is to minimize contact, because they really much stress that you have to be, you know, you have to keep your distance, you have to be healthy, you have to be safe, because you need to be safe in order for you to take care of others. So it's been kind of hard in that sense, in that regard. We see people as young as 26 years old, 37, 80, 70 years old, getting sick, dying. But we have those that are getting better, even with asthma, getting better and going home. You know, so it's really, there are a lot of things that, you know, affect the outcome of the person. Of course, they mentioned comorbidities like diabetes, high blood pressure, you know, those are things that really affect people. There's a lady, you know, so, but anyways, so you find people, I know they say, oh, there are some people with no history, no prior history, that are dying. But you know what? You have to keep in mind that a lot of people don't go to the doctors like they should. So if I haven't been to the doctor for 10 years, and I come up with a disease and I go to the hospital, they are going to list me as someone who has no prior comorbidity. But I might have diabetes, I might have high blood pressure, I might have high cholesterol, you know, I might have a gut infection. And all those are going to affect my outcome. You know, so, but anyways, typically when I'm here, as I come home back to the hotel, I go to the front of the, you know, the entrance. It's kind of dark. Let me come and put the light on. You can see this area here is like my clean area, my dirty area actually. That's where I come, take off my scrubs. I have a green bag. It's clean now, but the green bag, I put it over there. I put my scrubs in there. This area right here is what I have coming from the hospital. I don't touch that area. I don't touch anything there until I have to come back. Like just now, I went over there and I had my socks on. So I'm gonna have to take those socks off, because I don't know how, you know, contaminated they are or anything like that. So I'll have to switch socks and make sure I wash my hands. But pretty much, as I go to the bathroom, I have to walk, you know, close to the wall here, make my way to the bathroom, and take a shower right away after I come back. Things that I use as far as taking a shower, I use a bar soap. This is a alkaline silver soap. So alkaline silver is good because it helps cleanse the skin and kills bacteria and some viruses. So that's what I use for my hair. I wash my hair every day. Wash my glasses every day also when I come back, because I don't know what, you know, got on my glasses, so I have to wash them every day. Not the best thing for my glasses, but hey, that's what I have to do. I also take, you know, the silver solution that I take a little bit morning and evening. For protection, I have my essential oils over there that I put on my skin. Deodorant that is toxin free. And I also have my supplements right over here that are supposed to boost my immune system. I have my buffered sea powder that you see right over here. I take my probiotics because don't forget 2/3 of the immune system is located in the gut. I take some hydrochloric acid with pepsin because this is a very stressful time, and with stress that affect your digestion. So I'm just trying to maximize the food that I'm taking and get all the benefits from it. I have the curcumin turmeric that I'm taking here. NAC, all these are good for inflammation, repairing oxidative damage, and immunity. And you can see here I have my Juice Plus that I make sure I take every day for extra, vitamins, extra minerals. Artichoke, very important for the liver, for detoxification. There are a lot of things that I'm taking. Someone will say, I take also astragalus, very important for boosting the immune system, and some kind of lymphatic drainage, combination of echinacea, red root, because a lot of immunity is in the lymph nodes, so I want them to be draining well so that they can help me fight off infection and things like that. Water, melatonin also that I take, because it's been said that melatonin is very important as far as that could be that high good levels of melatonin is seen in children, and that could be one of the reasons why they are not so affected by this virus. So I take some melatonin just to to help with that. But anyways, so those are the supplements that I take. Those are the steps that I take to protect myself. I dose enough, I have no idea, but I do my best, and with prayer, pray that God does the rest. Anything that I touch, doorknobs and things like that, I come and wash my hands, clean my phone. When I'm in the patient's room, I don't touch my phone because there I just will contaminate it. Before I leave the hospital, I make sure that when I in the hospital, I cover my phone actually in one of those biohazard bags. And when I leave the hospital, I make sure I clean it with disinfecting wipes before I leave. I don't have any disinfecting wipes here, but I have a good friend of mine, Kaylee, who is going to send me some. Thank you, girl. And I have Donnie, who also provided me with some masks over here. I haven't gone through them yet, but I have them here, and they're N95 approved, so I'll be using those as well. So thank you, Donnie, so much for that. But yes, those are the steps that I take to protect myself, and pray that it's enough. So I'll keep you posted as the days go by. If you have any questions, comments, please let me know. You have a great day. Bye.